Our mission statement calls us to extend the healing ministry of Jesus in the tradition of the Sisters of St. Joseph of Orange by continually improving the health and quality of life of people in the communities we serve. And so I want to bring you back to two pieces of our mission statement. The first piece talks about health. We're here to promote health. When you come to the hospital, we provide you great quality, compassionate care. When you come to our Family Resource Center to meet your health care needs. But we also look at quality of life issues that really impact the long-term health of the community, which is why we focus on things such as education, making sure that students do get to enroll into college or career programs. And we look at affordable homes to make sure that each person has an opportunity to be able to have a place that they call home and that they can be able to afford. I think as we've talked about, we know that high-density communities are a big issue. South Orange County is a very expensive place to live in. And as we've seen, college students. I think back to when I graduated from UC Irvine in 1999, my first job, I got paid $24,000 a year. And so with that, what could I really afford? And I just think about our college students now and what they might be facing. They have to live at home. They have to have cars to be able to commute to college every day. Next slide. So I wanted to give you a sense of how serious the lack of affordable housing is in our community. And sorry, I forgot to mention, we have the slides in Spanish on the right-hand side and the slides in English on the left-hand side. So we have a couple statistics here for the general landscape of Orange County and affordable housing. For example, the median rent for a two-bedroom in Orange County is now $1,600. And so what does that mean? In order to be able to afford this apartment without having to pay more than 30% of your income towards your rent, you would have to have a monthly income of $5,300. A person earning minimum wage would need to work a total of 153 hours a week in order to be able to afford this two-bedroom apartment. And the hourly wage that you would need to be able to afford this apartment would be $30.67. Next slide. So I wanted to highlight what does low income mean in our community. So a very low income person would be somebody that earns 50% of the median income. And wanted to highlight for the year 2000, based on Census 2000 data, the median household income was $60,823. When the census was taken at that time, it was estimated that 31,000 or 17% of South Orange County households were considered very low income. The 2008 estimated median income is now at $84,100, and it's now estimated that there are over 33,000 South Orange County households that are considered very low income. Of this group, 22,000 had to pay more than 30% of their income on rent, and 9,500 had to pay more than 50% of their income on their rent. Next slide. Here. So, we always talk about, well, who are the people that live in these affordable home developments, and who do we need to house in our community? So I wanted to give you a couple of examples. So people who earn less than $50,000 a year can afford a rent between $700 to $1,200 a month. And who are these people? To give you an example, your child care provider. I know I take my daughter every day to the babysitter, and she's earning an average of about $28,000 a year. The bank teller, when you go withdraw your money, the smiling person that's there to help you, they're earning $30,000 a year. An office specialist or an administrative professional, and by the way, I'll be out there, happy Administrative Professionals Day today. Another example would be the entry-level teachers. So the teachers that you're sending your kids to school every day to learn from. They make an average of about $49,000 a year. Next slide. So who would need to purchase for sale housing? Those would be people that earn less than $100,000 a year. Another example would be a teacher at a step 5 level. They make between $55,000 and $79,000 a year. Another example would be a fireman. The clinical nurse too. So when you come to Mission Hospital, you want to make sure that there's nurses there to be able to provide you with care. And so nurses are averaging about $67,000. Associate city planners, the ones that are working hard to make sure your community in your city makes sense, they make about $65,000. Next slide. So now I wanted to focus a little bit more on San Juan Capistrano. And in this map, you'll see what the median household income is for several block groups throughout the city of San Juan Capistrano. And you'll see that there's quite a bit of diversity in terms of the incomes that are there. And it's color-coded there. I know the printing is really small, but you'll see that a large majority of the community is earning between $40,000 and $65,000 a year. So that's definitely not enough a lot of the times to be able to afford your rent or your home. Specifically, the median household income for the city of San Juan Capistrano is $67,432. In order to be able to rent a place or own a place that's affordable to you, you'd have to have a rent of only $1,685. Looking a little bit deeper, we looked at the American Fact Finder from the U.S. Census, and based on that data, we found that 55.4% of residents of San Juan Capistrano do not meet the Orange County area median income of $84,100. Next slide. Now I wanted to show you the different block groups as well, and showing you the density of people that are paying over 35% of their income on housing. And so we're seeing that a large majority, again, those green areas are paying greater than 35% of their income. And specifically for San Juan Capistrano, 37% of households are paying greater than 30% of their income for housing costs. Digging a little bit deeper, I wanted to talk about some affordable housing challenges for the city of San Juan Capistrano. Next slide. On a community health needs assessment that was conducted by Mission Hospital in partnership with Saddleback Memorial Hospital in fiscal year 2008, we found that 19.8% of residents in San Juan Capistrano pay between $1,500 and $1,999 for their mortgage or rent. Another 19.5% pay $2,500 or more toward mortgage or rent. 18.9% had to work extra hours in order to make their housing payments. 75.2% rated availability of affordable housing as fair or poor in their community. And 15.9% rated the condition of neighborhood homes as fair or poor. Next slide. When asked the community what they saw as major problems for their families and their community, 39.6% rated the economy and finances as the #1 problem for family problems today. 9.2% rated lack of housing as the #1 problem facing the neighborhood, and 7% rated lack of transportation. Next slide. So I know you're familiar with the city of San Juan Capistrano. We're asked by the Regional Health Needs Assessment to develop and provide housing for our community residents. So here's just an overview of those numbers. And next slide. And finally, I know that affordable housing is a big issue, and it's something that we definitely want to address, and wanted to tell you, Mission Hospital is working in partnership with several community organizations and local cities to address this issue. We've developed a strategic plan in partnership with the cities of San Clemente, Dana Point, Mission Viejo, and San Juan Capistrano to help address this issue. And Dana Point, San Clemente, and Mission Viejo have sent their city housing coordinators to our meetings, and they've been meeting with us for the past probably about 8 months now, and really doing a lot of work in this area. So we hope that the housing coordinator from San Juan Capistrano can join us soon to be able to work on this issue as well. Thank you so much for your time.